asked the AARP to reduce that 1,800-page document down to only 100, 200 pages. Go to the bullet points so we the people can read that. Not wait till after it's voted upon and we say we didn't see it. There's too much hidden in there. It's contradictory. And we are fed up with government from the standpoint of taking our lives and independence away from us. I came from a family that came here, and my question is, what are we going to do about it? Okay, and if you're not going to change this is a moot issue. Socialized medicine, go to Canada. Wait 6 months for a wheelchair. I have a story to tell about a very close friend. Master's in nursing, worked in the system in Europe and Britain, in fact. Had a lump in her abdomen. Had an x-ray. Had to wait 8 weeks for a CAT scan. She knew the people. She still, and this is with knowing people, she got preferential treatment. 6 weeks when they did the CAT scan. The lump, the mass now, 3 times bigger than it was. She begged us to try to hire her into the system over here because she couldn't get care. We have the best system in the world. We really do. Look around the rest of this world. We have no other country in this world, free or third world country, that can compare our research. Physicians come here to be trained. The impact this is going to have on physicians that are well-heeled and have worked their way, and they paid off their $100,000 to $400,000 loans to get their MD degree here, we're going to be losing all of our, a high percentage of our physicians.
Thank you for your question. Thank
you. What is the next color?
Next color will be white.
Okay, all those that have the white cards, please come up. Please, we only have 2 minutes up here. Ask your question. We appreciate that. Thank you.
Let me say one other thing. There's a young lady keeping time on your question. I know it's hard when you get excited about your question, but she's going to hold up a sign that says 30 seconds. That'll let you know that you have 30 seconds left. Get to the beat of your question within that 30 seconds, please. Thank you so much.
My name is Joe Davis. I live in College Springs, and I get right to the beat of the question. What is there in this plan to increase the infrastructure of the medical profession and facilities? Where are the doctors coming from? Where are the hospitals coming from? Where are the emergency rooms coming from?
I will answer that, and that's a great question. We have, especially where we have one of the greatest shortages in primary care physicians. And this bill will help increase the number of primary health physicians. There are scholarships, there are grants. We have funding in here to make sure that we increase the flow of doctors. The other reason is, and I'm glad you asked that, because that's why I'm pushing so hard to get the president to include the medical liability, because that is the #1 reason why we're having a doctor shortage. And we have got to get that on the table, because if we don't have more people, and the only way you're going to solve the doctor shortage problem is you got to get more of the young people wanting to go into medicine, into nursing, into these programs to help build the supply. Because quite honestly, if our bill passes, even this modest effort with the public options and other things involved in it, with the whole emphasis, once you put the health care insurance up there for 98% of the American people, we don't even right now have the infrastructure to attain that. So we're going to have 13 years or 2013, 2014, when the meat of this comes together. We've got to have that infrastructure together. So within this bill, our mechanisms, our programs, our funds to increase the supply of doctors. I also believe if we put the medical liability issue on the table, that also will help us increase the doctors.
Well, yeah, it's only actually one question per person, please.
That's a good question. And it's a very good question, and I would add too, AARP has endorsed a bill by bipartisan Republicans and Democrats in both the House and retooling our workforce for the elderly, which looks a lot at how our workforce can be retooled to look at how our population is aging. And not only for physicians, but all of our workforce, our nurses, diabetes educators, ways to deal with chronic conditions, and ways to work in urban and rural areas that are differently, because of course our workforce needs are different, in ways that we can attract people to these issues. And we're proud to say that those provisions are in both bills. It addresses training issues as well as team-based care issues, as well as giving people opportunities to get funding to get back into jobs where they have maybe some unemployed people that just need some recertification to go where we know the population and demographics could go then to areas where we have high needs. So we think these are common sense solutions to where we know there are needs for workers as well as needs for people to get a job.
Thank you, Mrs. Next question.
Okay, my name is Mike Walker. I'm a retired Army veteran. My family's from Taylor County, Georgia. I live in Mapleton. I agree that there needs to be health care reform, Congressman, I really do. But I don't believe in this plan. HR 3200 is 1,100 pages of nonsense, okay? Currently, we're projected to commit 83% of our gross national budget to fund this government. I don't know how we're going to afford to take more revenues from the taxpayers and fund more additional government. We are now working into August every year to fund the government. When is it going to be? Is it going to be September, October, November? The package that we currently are facing, this along with cap and trade, the bailouts, the car buyouts, it's too much money and we can't afford it. The plan that we have in front of us is too cumbersome. I've read the plan, and I have an MPA, and I can't follow because it takes you from code to code to code to code. Now, my question is this. In section 116 of HR 3200, it has the insurance commissioners determining what the loss ratios are going to be for the insurance providers. How is that going to be done, number one? And number two, if the losses do not reach some ratio that they think is reasonable, then they're going to give a rebate to the consumer. Don't have a problem with that. But what if the losses do exceed the premiums? Are they going to go back to the consumer and ask for more money? And lastly, as a comment, I know I'm not supposed to ask one question. Explain the Comparative Effectiveness Research Task Force. And lastly, are you going to have another town call me? Thank you.
Okay. All very, very good questions. If I can remember each one of those. On the ratio issue, that is in one of the bills to help provide a mechanism for us to see where we can apply the greatest efficiencies. It's not finalized or worked out. I want to give you, if I may, a good explanation here of the other point that you had mentioned, because I think that is an important issue.
Can I hear you? The mic's out.
I think there is the comparative, I think it's in this part still. Yes. I think that here are the facts on the comparative effectiveness research. What the bill will do, it will empower physicians and patients to make the best decisions. There are some who express an opinion, as you did, that the comparative effective research is trying to claim government panels would decide what care you can get. But that is not true. The bill explicitly prohibits the Center for Comparative Effectiveness Research and the Comparative Effectiveness Research Commission from using any of this research to decide, to define, to limit, or manage